And welcome back to the broadcast. We shift gears, but still on, current affairs and development in the country. So hugely something that would be aligned with the aspect of governance, and it's a focus on universal healthcare, the gains that we've made as a country, what needs to be done moving forward. And therefore, while we could be having key players that are involved in making sure that, Kenyans are able to achieve, universal healthcare, there are others who are keen to oversee this process, highlight the nitty-gritty details that need to be highlighted as pertaining to the failures. And, moving forward, we're able to have a conversation as to how we get this realized. And, years into this, from around 2018, where the government hugely and President Owuor Kenyatta pushed so much so on the conversation of, just universal healthcare, we have made few gains, so to speak. We're having we're looking at the papers this morning, and at some point in time the governors argue that COVID-19 was a blessing in disguise for the counties, because it's at this point that a majority of counties realized so much development in terms of the facilities that we have on board. For the very first time, we're talking about having ICU units, that push by the government to ensure that they have ICU beds, in about 30 days. This was realized across all the different parts of the country. And so, as the facilities were made better, the question is just how better are they for the people to be able to access universal healthcare. And we're talking about universal, we are also speaking about the aspect of affordability. And so Michael Owuor, Research Fellow for Development at GLOCEPS, joins us this morning. Once again, GLOCEPS in full?
GLOCEPS in full is the Global Center for Policy and Strategy. It's
a pleasure to have you.
Thank
you. The other time
much.
We had Janet.
Yes.
Yes, and it was a good conversation as pertaining to security. And here we are on the aspect of health. And I have started by saying one of the pillars of President Owuor Kenyatta, one of the key things that a majority of African countries seek to achieve, that is universal healthcare, trying to borrow from the United Kingdom system, trying to borrow from what Canada is doing. But then again, we still have not been able to make tangible gains. And if we have, then there's still mishaps, that lie therein. Why do you suppose it's so?
Thank you very much, Linda, for this opportunity. I think this is a conversation that is really ongoing. Especially with regards to how do we ensure that at the end of the day, everybody that needs healthcare will get the healthcare. Yeah. And this is mostly with regards to what we're supposed to achieve under our Constitution, Article 43. From where I'm sitting, I think there needs to be much appreciation that as much as we are not where we are supposed to be, right, we are not worse off than where we were. Actually, there have been tangible gains which have been realized, and the political goodwill, especially to roll out this program that we call the UHC, is one of those in that direction that the government is taking keen focus on the need for equitable and affordable healthcare for all. So that political will and the resources that go with that is an illustration that this is a key focus for the government.
Before we delve deeper into that, the biggest question then would be, like you rightfully put it, we have made gains. Yes. What stops us from getting to the level that we have wanted to be? Because when this goodwill is showcased by the government, in most cases they'll give timelines. They'll tell us, by the time it's this and this year, this month we'll have achieved this and that. But even with the timelines that have been set, we have not been able to see this achieved. Why?
I think that's a very good question. From what we are doing at the Global Center for Policy and Strategy, analyzing the health system as a whole, is that we realize that the health system, the focus usually, especially with regards to silos. Health system in totality is wide. It has 6 pillars that support it, of which health financing is only one of them. So when we talk about universal health coverage, what people usually miss is that it's not about financing alone, it's not about the health stuff alone. There are other aspects, for example, infrastructure, which you already mentioned, which needs to be rolled out and strengthened. So the idea of only strengthening one pillar of the health system does not really support the whole system, health system as we know it. Number 2 is that the other challenge that we're foreseeing is that under the Constitution, the health function is a devolved function.
Right.
Meaning that one arm of government is responsible for an aspect in terms of policy and leadership, but the implementation is a preserve of the county government, unless you're dealing with the Kenyatta Hospital, which is still under the national government. So when we have, for example, functions being devolved and resources at the same time not being devolved as much, because the county government still depends on the national government to finance this aspect, you see that there are incongruences,
right,
or what we call the teething problems. And those with time are what I think the government and the stakeholders are trying to resolve to make sure that the health system is harmonized and working as it should be.
And we probably need to expound further on this conversation of financing universal healthcare in the country, and probably just reflect on the mandatory financing processes that is under the NHIF Act, and the adjustments that have so far been done. And there have been complaints as to how this has been balanced somehow, and these adjustments seek to see to it that those ones who are getting more money are able to finance even more in comparison to what we have had for the longest of time. If you look at the arrangement of NHIF and what it's been able to achieve so far, would you say we are on track, or maybe there needs to be so much that would be done to make this mandatory financing even better?
I think just to make the conversation clearer in terms of health financing and the issue of mandatory contribution under the NHIF Act that has been passed, is to really appreciate the journey that we have come through.
Yeah.
First of all, the way we finance our health system requires a number of sources of financing. Typically, this is through government contributing taxes, or you pay taxes, which go into healthcare, which as it currently stands at a third. And then you have what you are contributing as NHIF or social insurance, and what people pay out of their pocket, which is also another third. And then there's also another third that usually comes from the donor community and other development partners and faith-based organizations. Now, the reason why the conversation with regards to mandatory health financing is important is the realization that as a country we have made gains, and those gains have come with what we call repercussions, for the lack of a better word. As you notice that Kenya has moved from a low-income economy to a low-middle-income economy. Typically what that means is that from the development aspect, is that it means that your economy is strengthened, and as a result you are supposed to start taking care of yourself. Now the development partners, who have been a very major contributor to health, are now forced to start shedding off some of that load. And when that load is shedded, then it means that somebody has to pick up. Now the government may not be able to pick up that, meaning that somebody else, for example the citizenry, will need to be informed on how to contribute to make sure that the health system does not collapse in terms of financing. Yes.
All right, and we speak of that. I have had conversations with officials from NHIF, and they speak hugely of the numerous challenges that exist therein. We probably could be able to deal with what is here as a challenge, but again, like you rightfully speak, there are potential challenges, moving forward, and therefore, if there are ways that we can be able to arrest such or cap that before we get to that level, then it would be a plus. So, in these processes of research, what would you pinpoint as possible challenges towards universal healthcare, and how well can the government then come in or step in to make sure that this is addressed?
The most important feedback that we are, as we are looking at the universal health coverage and how it's financed, one of the critical challenges that is there is with regards to awareness. There is a general lack of, for example, appreciation within the population of why there is need to contribute towards these the NHIF. And for some people it makes sense because, especially for the youth, is that I do not fall sick as often.
Yes.
So I do not need to pay for that amount of money. Number two is that there is the general lack of faith in the NHIF structure as it is, because of issues of corruptions and scandals, and that really weathers down confidence.
Okay.
Now, what happens is that the way the NHIF system is based is a social insurance system of coverage, meaning that you depend on everybody to chip in. You may not be able to get the health services then because you do not fall as sick, but it means that it's like an harambe, so that what you contribute helps another person.
Yeah.
And then when your time comes, when you fall sick, then also the contribution of other people also helps you out.
Yeah.
So where there is the general lack of appreciation of why this is important, really affects the uptake of this very noble initiative.
Is there a proper understanding of, the function of NHIF, to the people? Because normally, and you'd agree with me, you get to meet NHIF, or you get to understand something about NHIF when you probably get a job, and you're told it's mandatory that you have to contribute to NHIF, and probably nobody bothers to explain it even further. And so would we say it's that reluctancy and lack of confidence, or probably there's not been so much of a civic education that has been done revolving around this?
That is true, and some people will even contend and say that they do not pay NHIF. They have NHIF taken away from them. From them.
Yes, that's true.
That is essentially it. So when you look at the general statistics around NHIF contribution and also health insurance in general, we find that 8 out of every 10 of the Kenyan citizens lacks health insurance cover of any kind. That is NHIF, private insurance. They do not have that kind of, and the two is synonymous with people who, you have rightly said, are in formal employment. But 77% of the Kenyan population, that is 7 out of 10, are in the informal sector. So if there is the general lack of awareness of why this is important, and the general lack of appreciation why this is important, then people are less willing to buy into the concept that is NHIF. And that is why, as one of the things that we are proposing as the Global Center for Policy and Strategy, is that there is need, even as they roll out this new package, to really go out and make it a massive campaign, so that people really have that understanding and appreciation why this is important, and also the NHIF can be able to receive feedback why people are not enrolling into the services.
Right.
Because the simple idea of making it mandatory does not guarantee that people will contribute. As it is currently structured, the NHIF Act mandates that contributions are mandatory. So by law, it is mandatory. But in practice, it is voluntary. Because how do you enforce this? So without having the buy-in of the citizenry to really appreciate why this is important, that is where the gaps now lie, and we have 8 out of every 10 of the Kenyan citizens either not enrolled into private, into NHIF, number one, and number two, in any form of insurance. And then very importantly, is that, this is a conversation that we need to have, is that the addition of the premiums or the cuts does not really translate to increase in premiums. Because of one thing, there is the general concept as a normal human being, a rational human being, is that you need value for money.
That's true.
So for example, if you're earning $1 million and then the government tells you that we'll be taking 1.7%, that is 17,000 out of your payslip, but you're well aware that from the market, you are able to get a private health cover, which is better and more functional to your needs than what NHIF is providing. You will be conflicted to join NHIF, even if it's mandatory. So these are conversations that we need to make sure that we have to advance and make sure that NHIF as a fund is competitive in the market that we are operating in, and also in tune with the needs and desire of the citizenry that it needs to serve.
And true to it, we have seen arrangements like that of NHIF working so well in other countries, and probably trying to borrow a leaf from there, picking up on what they have done and how they have managed to achieve that. It's working so well in the United Kingdom. Of course, we have others in the United States. Well, we could say they're bigger brothers, and we're picking cue from them. It is important that we pick cue and we get it right. So what are some of the lessons that we can pick or we can learn from the countries that have successfully achieved this?
One of the lessons which, and I'll give two, that can be learned is that there's the general need of appreciation that health is a social service. Similar to education security,
Yep.
It is not usually deducted from your pay that you need to, but at the end of the day, you expect that from the salary that you are taking is being part of your tax, is supposed to pay for these services. So there's need to have health also included into that bracket.
Yeah.
And that is why, for example, if you're mentioning the United Kingdom, the health system is to a very large extent financed by payroll taxes. So that people, it is deducted from their pay, as painful as it is, but because there's the guarantee that when I need health services of whichever nature, I'll go to any health facility and I receive quality, affordable health care. That is number one.
Okay.
So there's the need for a new mechanism in health financing. Number two is also learning from our peers. For example, Cuba. Cuba is one of the countries which is loaded to have one of the best health systems in the world.
And we tried that.
Yes,
we brought Cuban doctors in the country, but
yes.
still.
Now, the appreciation of how the Cuban health system works. Number one is that the Cuban health system is financed by 6% of the annual budget, which is more or less what we contribute in terms of to the health sector of financing. It's equivalent. Number two, there's also the general appreciation that the way the Cuban health system is prioritized. They have re-engineered the health systems to ensure that they place focus where focus needs to be placed.
Okay.
Meaning that they focus on the primary health care, prevention and promotive health. So that before, for example, health deteriorates, they're able to curb it. And we find that even the doctors, one of the courses that they usually are required to take part in is that they're supposed to learn about community health.
Yeah.
And it's the doctors who go household to household, checking on people to make sure that they're well. So that ensures that, one, the health system and the people are together. And number two, it ensures that you are able to catch some of these diseases before they become expensive to treat, like cancer. But the way our health system is designed currently, it's very disease focused. We wait for you to get sick. That is when you're able now to use the NHIF.
Right.
Those are the challenges that needs to be addressed.
Okay, well, in these other bigger brothers, or in these other countries, you'll always realize that, even the checkups are very necessary.
Yes.
Important. It doesn't have to get to that level where one is sick. So you have spoken of devolution, and we all understand how important devolution is and how it has worked or appears to be, promising in terms of Kenyans getting, services down on ground, and most importantly,
Sure.
them, getting a chance to be actively part of growing the nation development-wise. Many have argued, or there are others who've argued, it was not right, it wasn't the wisest thing to do in devolving healthcare. And at some point in time, people have said, let's get a health commission, like the Teachers Commission. That we would be able to address the problems that we have in the country. How much, in your own opinion or in your own assessment, has devolution been of an advantage to the growth of the health system and generally to the dreams of achieving or the hope of achieving universal health care?
There's the appreciation that devolution has played a critical role in advancing healthcare in Kenya. Number one, why do I say this, is that it allows the citizenry at their level, community level, to be able to determine and also prioritize what is important to them in terms of health. And a lot of health infrastructure, as it were, that were not there before in the post-colonial era, have now been added into the bag of products that people can access. So with that regards, it has really made it possible. The challenges that are there, some are teething problems, some are critical.
Okay.
One of the most critical challenges that are there is that the county health system, as it were, was not prepared to take up other functions, and these are things that need to be appreciated. For example, the management of the human resource for health, especially doctors, nurses, clinical officers, and other physicians. And because of that, there are teething problems that are happening.
Right.
Some are getting it right. For example, Makueni country are getting it right. But in all sense and purposes, there are others who are really struggling.
Okay.
So there's the general appreciation that we need, for example, to take some of these functions which are more attuned to the national government, back to the national government.
All right.
But there are other functions, for example, delivery of services, health services, which are more attuned at the localized level. And that is what should be pursued.
All right.
Yes.
Okay, well, as we come to a close, the components that we'd say are, to take home, to help us with the action plan, to help us with, the much anticipated and hoped for achievement of universal health care in totality.
Yes.
As we close.
One, as my parting shot, is the general appreciation of the disease profile that we have as a country. One of the critical aspects that we have currently is non-communicable diseases as a critical issue in the healthcare system. And it's very expensive to treat and also to diagnose. However, there are simpler methods that can be explored with regards to that. For example, high blood pressure, we have tests that can be done cheaply. Screening, for example, for cancers, whether it's cervical cancer, prostate cancer, when they are detected earlier, it becomes even less burdensome to the health system. So the general re-engineering of the health system as we know it. Number two is that there's need for increased awareness of why NHIV is important, what NHIV is, and why we need to promote it. And thirdly is that for the next government that is coming in, there's also the need to prioritize health, because health is wealth.
Well, one of the sectors that gets the largest chunk when we're talking about budgets, and so we can only hope that these monies can be put to the right use and we are able to achieve this, what we look at as a dream right now. Once again, Michael Owuor, Research Fellow for Development at GLOCEPS. Asante sana for creating time for us. We hope to have more of these conversations for the betterment of our very own country. At this particular point, we close it and we cross over to a different one after this break.
We see them, we interact with them, and we know them. But how do we show them love?
They start now accepting us like the way we are accepted in churches.
Accept na wamuonyeshe full love.
They passionately tell their stories here at Beyond the Limit every Saturday at 7:30 p.m.
We all have something we love and treasure, and for us, it's farms. In this month of love, we get to walk you through different farms and get to talk to different farmers as they show us how we love and care for both plants and animals.
Goats produce milk into different stages depending on their lactation.
And the best earthworm for composting is called the redworm.
Pomegranates normally they do well or best in either warm or hot regions.
Join me, Sandra Wahito, as we take a trip to these farms every Sunday at 6:30 p.m.
Imagine a man.
Man should protect your own.
A young man on social media or any normal setting.
It's so wrong for a man to go on social media, you're trying to do some dances, you're gyrated.
What strikes you about him? Is it his personality?
If a man is in the kitchen and his woman is there, simping.
His financial situation?
I understand.
Family banner. Congratulations.
We see them, we interact with them, and we know them. But how do we show them love?
They start now accepting us like the way we are accepted in churches.
Accept na wamuonyeshe full love.
They passionately tell their stories here at Beyond the Limit every Saturday at 7:30 p.m.
We all have something we love and treasure, and for us, it's farms. In this month of love, we get to walk you through different farms and get to talk to different farmers as they show us how we love and care for both plants and animals.
Goats produce milk into different stages depending on their lactation.
And the best earthworm for
047.
We see them, we interact with them, and we know them. But how do we show them love?
They start now accepting us like the way we are accepted in churches.
Accept na wamuonyeshe full love.
They passionately tell their stories here at Beyond the Limit every Saturday at 7:30 p.m.
We all have something we love and treasure, and for us, it's farms. In this month of love, we get to walk you through different farms and get to talk to different farmers as they show us how we love and care for both plants and animals.
Goats produce milk into different stages depending on their lactation.
And the best earthworm for composting is called the redworm.
Pomegranates normally they do well or best in either warm or hot regions.
Join me, Sandra Wahito, as we take a trip to these farms every Sunday at 6:30 p.m.
Imagine a man.
Man should protect your own.
A young man on social media or any normal setting.
It's so wrong for a man to go on social media, you're trying to do some dances, you're gyrated.
What strikes you about him? Is it his personality?
If a man is in the kitchen